What does radioactive iodine do? How does it take care of an overactive thyroid? How do you do it?
Well, it is so neat, Bob. Radioiodine is the medical equivalent of a smart bomb. It seeks out and destroys just what you're trying to kill off and doesn't affect anything else, because the only tissue in the body that concentrates and stores iodine is the thyroid.
So it's pretty simple. You give it through a vein or you take it by mouth?
All done as an outpatient through the office. The treatment is really complicated, Bob. The treatment is, here, swallow this pill.
So
it takes about 3 seconds to
You swallow
get it
this pill,
off.
it concentrates in the thyroid gland, and then what happens? What does it do to the
thyroid? The thyroid cells can't tell the difference between a radioactive iodine molecule and one that came out of a salt shaker. Chemically, it's iodine. So they do what they think they're supposed to do. They concentrate that iodine all up. It's sort of like killing rats with decon. If you can get those rats to eat enough of that decon, they're going to die.
So the thyroid gland is going to die.
Mm-hmm.
Does it die all the way? Do you have to replace with thyroid hormone later on?
Well, typically as the thyroid ability to make hormone gradually rides off into the sunset, and the response to the iodine treatment now takes several months usually. Once it gets down in the low range, the thyroid levels get lowish, then you just start a little pill of natural thyroid hormone. That's one little pill a day, dirt cheap, 0 side effects, because it's just a natural body product. God owns the patent. Same thing that's in your bloodstream right now.
So when you take radioactive iodine and it kills the thyroid gland and you have to replace it, how often do you need to test the thyroid studies to regulate whether or not you need replacement?
Well, when you first start during this transition phase, you check it about every 6 weeks or so, because you have to fine-tune the dose. But once you, it's like trying on clothes. You know, you start at the end of the rack and you work your way up until you find a size that fits you. And when you find your size, that's your size. So once you get it stabilized, you typically just check it once a year.
Frequently, if you use radioactive iodine, do you end up replacing with thyroid hormone?
Oh, yes.
Yeah. And
yes.
and that's an easy, simple medicine that makes life, you mentioned once before, several months ago, what does it make life like?
Blissful.
Blissful is right.